Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Best of us, Om Swastiastu, Namo Buddhaya, Great in Virtue. Honorable leaders and member of Commission 1 DPRRI, Ambassador of friendly countries and leader of Organization International, Elder and Able of the Level Ministry of Foreign Affairs of the Republic Indonesians, both and home and abroad. Leaders and mass media, college, fellow, journalists, students, and distinguished guests. Firstly, I'd like to wish you a Happy New Year 2022. Hopefully in 2022, the world can recover together and recover stronger. I'm Maulana Tepuri as the Health Minister of the Republic Indonesia. In this case, I'd like to have a press conference in the context of handling COVID-19 with the topic, the efforts of Indonesian government to protect the public from the spread out of the Omicron in several countries. The Indonesian government yesterday began rolling out COVID-19 booster shots from the general public in an advance of the prevalent first fresh outbreak from the Omicron variant of the virus. The Associated Press relayed that the government hopes to administer 21 million booster shots this month, prioritizing the elderly that's with combating immune system. The effort is important to increase the immune of society considering the COVID-19 virus keep multitasking, said Joko Widodo as our president. On Monday, Indonesia's Food and Drug Monitoring Agency announced that it had approved the COVID-19 vaccine, Sinovac, Pfizer, AstraZeneca, Moderna, and Sinovac. As a booster shot for the public would receive the second doses at least 6 months ago, several other vaccines are currently undertaking critical trials to obtain the emergency use permit. The Health Minister said yesterday the booster will be kept administered as the health in all the states of the Indonesians is limited suppliers of vaccines after studies found the simulation self-vaccine antibody response. The campaign reflects Indonesian determination to prevent the rapid spread of the American variants. Ladies and gentlemen, which is inviting a growing toll on some of the Southeast Asian neighbors. The Philippines has already exceeded the peaks from the last year's creeping outbreaks, recording the 3 consecutive days of recovery and record daily COVID-19 cases from the January 8 until 10th. Instructions are rising supplying in Thailand, which has halved the vaccine interpretation and the range of restrict and suspend a quarantine-free tourism program for vaccination travel. Ladies and gentlemen, Indonesia has ample reasons to worry. The country has recorded 4.2 million cases and more than 144,000 deaths since the beginning of the pandemic. While in per capita terms is the third lowest in Southeast Asia. Let's years. Several outbreaks have made the country's healthcare system, especially in the capital Jakarta and elsewhere on the densely populated island of the Java, like in the Banyumas Regency. While the situation in Indonesia remains reported stable there, 2 cases are beginning to creep out of average. On Thursday, Indonesia recorded 18 new infections, the highest in almost months, which was followed by a further 1646 yesterday, and the emergence of the new variant in the late November prompted the government's decision to bring forward the start of the booster campaign, which was initially supposed to get underway once 17% of the territory's population had been vaccinated. Initially, the Indonesian government prepared people pay for the vaccines and booster shots. Ladies and gentlemen, aside from the alleged steps without means, but rarely come to the conclusion that charging for the booster was a research for the vaccine house state. I have decided to provide the task of spreading charge to all Indonesian people. Safety is crucial. Jokowi said in the statement Tuesday, vaccination and the discipline is adhering to the healthy protocol are key to avoiding the COVID-19 pandemic. Ladies and gentlemen, in addition to the concern about Omicron, the booster campaign reflects Indonesian government's policy of promoting the vaccination of the most densely populated and having the most economic important regions of the country. This included Jakarta and Bali, the evaluations of Indonesian tourism industry, part of which have no attempts with vaccine coverage. Meanwhile, only 42.4% of the country's population have been double vaccinated, and many other regions have struggled to obtain sufficient efforts of the factions, like the Banyumas Regency, according to the report by Al Jazeera with the City Ministry of Health data. All ruling regions like Aceh and West Papua have committed to vaccine and about 20% of their population. Ladies and gentlemen, with the dedication made some alliances, given the country's limited supplies of vaccines, it's around the rates of runway tracks in southern regions given the health strain infrastructure and the less population attending its land and remains much more valuable. Ladies and gentlemen, this about the press conference our government today. Let us trigger cooperation, solidarity for a peaceful, stable and profitable recovery together, recovery stronger. Thus, thank you. Wassalamualaikum warahmatullahi wabarakatuh.